Welcome to the Personal Injury Guru Show. My name is David Papa, and today I've got a special guest for you. And her name is Connie Jo Russo. She is with Preventative Medical Rehab. And you're going to learn what she does at that facility to help people who've been involved in automobile accidents to get better. Throughout these series, you've seen surgeons come on, chiropractors, physical therapists. This is a little bit different. She does what is called the Beamer needleless acupuncture. Now, it sounds like a lot and it sounds different, but it works. And I am living proof. I actually went to her facility, and I would never have a guest on this show unless I could personally vouch for them. And she's very, very good at what she does. And she is going to also talk a little bit about the foundation that she's involved with. And it's about helping children with cancer. So we're going to also hear from that. And that's always huge. It's very important. We should all take heed to that. So without further ado, the Personal Injury Guru Show is coming up next.
This is the Personal Injury Guru Show with attorney David Papa.
Welcome back to the Personal Injury Guru Show. I am David Papa, and I am here with Connie Jo Russo. How are you?
I'm doing fantastic. How are you?
I'm doing well, thank you. Why don't you tell all the folks out there that are watching or listening exactly what you do?
Yes, I am in the sports rehabilitation, injury rehabilitation business. I started preventative medical rehab back in 2004. It was mainly in my Gold's Gym. We had a 40,000 square foot Gold's Gym that I co-owned. And we started the rehab. We had physical therapists, massage therapists, and occupational therapists.
Wow.
So it was wonderful.
Yep.
A little bit about my education. I went to school at the University of Florida, so I'm a Gator.
Nice.
Yeah.
We won't hold that against you. All the Seminole fans out there.
Yep. And I also went to the Florida School of Massage. So while I was going to school, I simultaneously was working, trying to make money. So I went to the Florida School of Massage, and I got my license in working with athletes, so on the sports side as well as the medical side. So that's a little introduction about my past. What brought me down here to the Tampa area is I'm also a licensed nursing home administrator. I'm not in the capacity of one right now, but I'm still in the nursing homes. I do fitness therapy programs, and I work with the nursing home patients.
Well, you've got a great deal of experience in PT, that's for sure.
Oh, yes, lots of experience, over 20 years.
Wow.
And I put training programs together and developed programs, implemented programs. I was one of the first people who brought Silver Sneakers program to Tampa Bay.
Wow, that's awesome.
So I trained all the instructors and rolled the program out and oversaw about 50 fitness facilities.
Very nice. And you know, folks, there's something to be said about experience. And I've been saying this almost on every single show. If you're involved in an accident, you need experienced people, because these decisions that you're going to make have to be based not just upon your experience, but upon those that you're putting your trust in. And here, Connie has had tons of experience. 20 years of experience is a long time.
It is.
I've had 20 years of this experience too, and you learn so much. The learning curve just keeps going up. You learn more. You're better now than you were before, and that's just what happens. I've had surgeons sit there saying the same thing. 20 years ago, our surgeries weren't nearly as effective. The technology wasn't nearly as good. We just didn't know enough. And it's the same thing with you now, I'm sure.
Yes, it's all about experience. It's all about experience. And then we also learn through our professional journey and life journey is that we look at every individual as being very unique. So when people come to me, of course, you know, we do a thorough background. We do a health history. We do all the intake forms. And then from there, we set up a program for you. Mainly what I deal with is soft tissue. So that's my specialty, is soft tissue, which any kind of trauma that you have in an auto accident, of course, you're going to need to get to a specialist, and that's what I do. And I help heal, break down scar tissue, and I actually help the body heal from the trauma.
And that's important, folks, because remember, when you've been in an accident, there's going to be trauma, there's going to be all sorts of scar tissue, you have to break that up. And you can do it several ways, but obviously Connie's been doing this for so long, she's at a point now where she can do that more effectively and efficiently. And that's very important because scar tissue, if I'm not mistaken, can be painful and can cause further pain. Is that right?
Absolutely, as well as other things to happen if we don't correct it. And that's why it's so important to get to somebody who knows what they're doing, like myself, as soon as possible. After, of course, you go to your doctors, you have to get clearance, we have to do all the diagnostics first. I wouldn't even do anything with anyone until they have full clearance before. And I do work closely with chiropractors and physical therapists and DOs, MDs. So I have for many years. And we have to establish great relationships because it's about being a team and about working with people in order to help them heal.
And if I may interrupt just for a second,
You
what
may.
you just said is huge because on every one of my episodes, I always try to tell people it's the teamwork between the attorney, the surgeons, like you said, the DOs, the chiropractors, the PTs, yourself, everyone working in cooperation together for the sake of the patient. And there's a lot, it's unfortunate, but there's a lot of places out there where if you go, the surgeon doesn't want to talk to the chiro doesn't want to talk to the DO doesn't want to talk to the neurologist, and vice versa.
Can't do that.
And it's a mess. And people are not getting the best help they can because of that. But what you just said hit it right on the nose, and that's perfect, is that you all have to work together for the sake and the benefit of the individual patient, because that's really what's more important than anything.
Absolutely it is. I mean, there's a lot of things that, we each have our credentials and how we have to treat people. So everything is so important. And just people have to understand that, and they have to be confident with who they go to as well. And of course, my experience, I take every person, that comes, into my office, and I try to help them, to the fullest extent.
That's
So-
awesome. And if you could, so talk about kind of a detailed step-by-step procedure. If someone goes into your office, they've been cleared, and you want to use, and talk about the Beamer needleless acupuncture that you did.
Yes.
Because I underwent that.
Yes, and it's wonderful.
It is. So I want
It
you to tell
is.
people really what that is, because it's important that people get educated on what it is. They don't know.
Yes, very powerful. So back in 2012, I trained under the person who developed the dolphin neurotism units, who is also an acupuncture physician. And this is needleless, but it is currents, and it will help break up scar tissue. And I also hit acupuncture points in order to try to calm the nervous system, which is so important, as well as working along the occipital ridge and the base of the skull, down the spine, in order to help heal the tissue. It's a wonderful therapy, and everybody that I know has gotten great benefits, all of my patients. And I work with the Beamer. I'm a distributor, as well as it's another fantastic therapy. It's not a direct current like the dolphin neurotism units that I have, but it is a electromagnetic pulse frequency. So what it does is it causes a vasopumping action in the veins, and it actually will help all the cells in your body. So if we have soft tissue injury, this will help so that it heals properly. And that's exactly what we're looking at. We want to get a good response, and we want to get a quick response. So I have athletes that come to me that I work with. I've worked with, major league athletes as well. And what they do, the sooner that they come to me, even children, I work with children all the way up to the elderly. The sooner you get to me, the better, because then I'm able to help you recover very fast.
And that's important. And the reason is because a lot of people have surgical procedures. And the surgeons, when they're done, they'll send you to physical therapy, and they do that. But it's not enough. You want to take that extra step, and you want to go try this therapy, because I myself had knee surgery. I had the therapy, and then I came and I met Connie, and we talked about it a little bit. We discussed trying to use a Beamer, and I went over there. And I'm going to tell you, it was a pleasant experience. It was not painful. And she was very professional, and she did a great job, and my knee is feeling better. And I have to believe it's because anytime that you have someone that can promote health and getting better, there's no reason to ignore that. It's very important to at least consider that when you're having chronic pain and you can't get rid of it any other way.
That's right, absolutely. We have to do that, and we have to do that as soon as possible. And that's exactly what I do. So I try to help people, as soon as they get clearance from their doctors, they come to me, and then I'm able to help you.
And that's important, folks. And just remember, not everybody does this. This is the first time I've met someone that did this type of therapy. So, like I said, I don't sit anybody at my table unless I feel comfortable saying, yes, I trust this person, and this is the type of person I've used for myself or my family. And certainly, it worked for me. It's been helped me, and I'm going to continue, of course, to go to you.
Yes, because you do. That's the key.
I know.
Because, especially initially, it's 3 to, at least a couple times a week. And we want to keep that going until we get really great results. And then, on a monthly basis, then you keep coming back to see me. And it's about a lifestyle, too. It really is, once we have injuries, the physical therapist, I know that they preach about this. I do as well. I do fitness therapy programs as an owner of a gym, as well as a personal trainer, and that I have been for over 20 years. It's about a lifestyle change. So we really have to not only correct the problem, but then we have to look at our whole lifestyle moving forward.
Right, because you're a different person after you've been injured, too.
Absolutely.
Yeah.
So we constantly have to maintain the body. Like we
Right.
would maintain our cars, like we maintain our houses, like we do everything that we have to do, to keep ourselves. We have to do that. We're number one. So we
All right.
have to take care of ourselves.
I agree 100%. So why don't you put someone in your eyes as they walk into your office, take them after the paperwork is all done, take them through the therapy. If you're standing up, laying down, what you do, just take everyone through it very slowly so they know exactly what they're in for.
Absolutely. So when you come into the treatment room, of course, people dress down to their comfort level, or they can even keep their clothes on. It's entirely up to them. You're going to be draped anyway, so it doesn't make a difference.
Right.
But I need access to, the skin, of course, with a lot of these therapies, especially the currents that I use. And you're going to lay down on the table, or you could be seated. If you can't lay down, we can always make accommodations for whatever it is that you need. And but you're going to be very relaxed. You're going to be on the Beamer mat, which is a large mat, and you lay on that mat for 8 minutes. And simultaneously, I have other attachments with that mat. So depending upon where the injury was, I'm able to, place the mat in order to help, circulation and healing. And then I use the needleless acupuncture.
Talk about that a little bit, because
Yeah.
I felt it. Mm-hmm. I've never had acupuncture done. I'm not very good with needles. I'm sure a lot of people probably tell you that. But this was different.
A lot of people tell me that. No, there's no needles, so it's
Right.
current. So,
Yeah.
of course, in the injured area, you might feel just like a little stinging, but not too much. It's
Right.
very tolerable, and the end result is you want to get rid of your scar tissue and the trauma. So,
Right.
it's well worth it.
And the scar tissue will break up inside, correct?
Mm-hmm.
That
is correct.
Is it a slow breakup, or it just mixes into your bloodstream and dissipates and things of that nature?
Mm-hmm. Well, it does, and that's what the Beamer will help too, is kind of remove toxins, and that's what we're trying to do. But yeah, it takes some time with the scar tissue, but I'm even able to break up visual, like scars that you can visually see.
Really?
Oh, yeah.
Exterior scars?
Exterior.
Really? I didn't know
Yes.
that.
Oh, yes, yes.
Okay, because that's important. Well, especially females tend to be a little bit more, susceptible to being embarrassed or upset about, scars.
Mm-hmm.
Guys, for some reason, somehow think that's kind of a cool thing, but I don't know. It's just throwing it out there. But
Yeah.
if you can do that, that would be something too for the people to know. How do you handle that?
Yeah, so the devices that I have, I go along the scar tissue. So I work both of the currents, and I just work slowly down, the scar back and forth. And it does take some time. It is a little bit more time consuming, but very effective.
Wow.
Again,
And you've had
yes.
people that have been satisfied with that.
Oh my God, everybody's satisfied.
Wow. See, that's awesome.
Oh, yeah.
That's important for
Oh,
people
yeah.
to know that this is something that's been tried and it's successful and people are happy.
Oh, extremely successful, as well as concussions.
Oh, yeah, that's a good
work
thing,
along
too.
the skull, and we just were able to, help heal from brain trauma.
Right.
From accidents, getting, of course, in accidents you're slammed. It's trauma. So this is a very effective treatment.
Very nice.
The combination, nobody really does this, the combination that I have. So I'm very proud of that, and I'm very happy with the results that I get everyone.
Well, that's what intrigued me so much, because I try to bring a fresh perspective onto the show so people can see somebody that does things a bit alternatively and different, but that are successful. That way, of course, it's not just beneficial for you, it's always about being beneficial for the individual who just can't seem to shake maybe the scar tissue or feeling better. And this could really help alleviate a lot of that pain, which is really awesome.
And these are medical devices.
Right.
Beamer is FDA approved.
Right.
Yep. And those neurotism units that I have, these are all medical devices that I incorporate into the whole treatment plan.
Well, when I walked into your office, I never got the feeling it was like, oh, this is not just right, or I'm not sure about this. Very professional. The equipment looked great. It felt good. It was non-invasive. And it felt better afterwards. So I said, yeah, this is legitimate.
Yes.
Yeah.
And then, of course, the hands-on work that I do, the different modalities that I do
Yep.
to, help remove that scar tissue as well. So I incorporate the massage into it. So it's very relaxing as well as healing.
That's awesome. And it's important to know that I only do these visits with her at lunchtime because Bread and Butter Deli's across the street.
That's right.
Oh, boy. That's my favorite lunch spot.
And that's a very healthy place because we have to look at the food that we're taking into our bodies as well.
It is. You are 100% right. The most important thing, and I tell a lot of my clients once they're done with their case, they're never, you want to say they're 100%, but they're never really 100% again. I think every time you have an accident, it takes a little bit away from you. And you have to make dietary changes.
Yes, you do.
You start have to drink more water, less soda, less coffee, things of that nature. You have to feel better, live a better lifestyle, and it's hard to do.
It is, and it's just not one thing.
It's not.
It's a combination of things that we have to do in order to heal our body.
Yeah.
Because food can cause inflammation, so that's why being educated on that is so important.
And folks, remember, I'm Italian, and I grew up with an Italian family, and I can tell you, inflammation from Italian food.
Well, the carbohydrates
is right there.
I am too. So yes, I know.
You know.
Right there. I know.
Yeah. Well, obviously you fared better than me. I've put the weight on because of that. The Italian food, it kills me. But anyway, so joking aside, I also want to talk to you and have you talk about the opportunity to speak. I see you have your shirt and your hat
Yes.
for Super Fit Kids. I would like you to spend a little time in talking about that organization and how people can help you.
Yes, absolutely. I started Super Fit Kids back in 2002, and we did. I had a pediatrician, dietitian. Of course, I still work with doctors and dietitians and behavioral therapists. And what we do is we try to help different children, unique to their problems. We're in the schools. We're at Our Lady of Lourdes. And of course, things have changed a little bit with the COVID issues that we had last year. But overall, we're just, we're all about children. We're all about children, and we're about teaching them this lifestyle, about being incorporating exercise into their lifestyle, proper nutrition into their lifestyle, as well as helping other people, because there are so many children in need. Like we're doing this fundraising event. This is a golf fundraising event, May 15th of this year, and it's on a Saturday. It's going to be 8 a.m. and it's for pediatric cancer. So we have aligned with Johns Hopkins. We do different charity events. I have always, with all my business, the gyms I've owned, the rehabilitation places, everything that I do, I always incorporate work that we do, outreach program with children. And this one is with pediatric cancer.
Well, that's absolutely outstanding. There's not enough people doing that out there. And I can tell you on a couple of different levels what you just talked about, it's so critical. Kids today play video games. They play video games and video games. They do not go out and exercise like they used to.
They do not.
And it's a problem. And I don't know if parents just are okay with the kids being babysat with these damn things, or they don't feel the kids safe outside. But don't be afraid to walk outside. Just go for a walk every night with your child. Mm-hmm. I've got grandkids and they love these video games. When they come to my house, they'll tell you, no video games. Put them at the front door and just hang out and play. Do something different. It seems like it's not just my grandkids, it's everybody's kids and grandkids. These video games are just dominating.
Yes, video games, the phones.
Oh, it's the phones, the video games.
Yes.
It's anything they can do other than exercise and go outside and walk around and play. And When I was a kid, I remembered I was outside from, when the sun up to sundown, and hell, we hardly came home for lunch. And if we did, we grabbed it to go, and we were running out and playing all sorts of games and running through the woods and just, you name it. And today, it's just not like that.
No, I know times have changed, and it's unfortunate, but we can make a difference. And that's what Superfit Kids Foundation is about. It's about teaching families, children, how to live this healthy lifestyle.
Awesome.
And trying to help one another, when crisis happens, because it happens with all of us, and we just have to be united instead of divided. That's a lot of what's happening in this world is division instead of unity, and that's really what it's about. So in any way, if you would like to sponsor, if you would like to attend the golf tournament, we would love to have you. Any kind of donations. I gave you that bottle of wine over there. We also, at the end, there should be a QR code. You can go to the website.
Yes.
And also we have these wonderful bottles of wine.
And that's your daughter on there with you.
And that's my daughter on there with me, Jasmine. Yep, and she's at CCC currently.
Right.
Clearwater Central Catholic, and the children there are going to be involved with helping with this fundraising event. Unfortunately, they lost one of their friends last year, 15 years old, to sarcoma cancer, and one of the other boys, 14 years old, with a brain tumor. So it's a memorial for them, as well as we were going to keep this ongoing so that we can help as many kids as we possibly can. And it's all about education and awareness and unity.
And that's awesome, folks. So as you see this, it's very important to see that anytime someone is doing any type of a charity event, you don't have to go and play golf if you don't play golf, but don't be afraid to contact Connie and make a donation, because it's going towards, obviously, the Pediatric Cancer Society. And I don't know that there's anything more important as far as fundraisers and taking care of children, and certainly with cancer. So I will certainly be having a golf team there, and we'll make our donation, of course.
Thank you, David.
But
Thank you so much.
And you're welcome, and it's very important. And I urge everyone watching this to remember there's more important things out there than just going out and having a good time. Sometimes you have to take a look over your shoulder. And if there's someone that's putting this much effort into making sure that other children have better lifestyle, or at least letting them live, it doesn't hurt to make a donation. So I urge you, if you want to make donations, where's the best place to make the donations?
Yes, you can do it right on the website, and you'll have that QR code that should come up on the screen. Or you can contact me. My contact information, I'm at Connie at superfitkidswithaz foundation.org. Or my cell phone number, you can call me, 727-992-1696.
And folks, that's important. I know sometimes people hear about a lot of charities and a lot of different events, but anything with the children and cancer, those two words together, they're horrible words. I mean, you're talking about people having just tragedies in their life. Everybody knows somebody who has had cancer, and it helps if you help out, especially with children. To me, that's the worst thing in the world as a child with cancer.
Thank you so much, David.
So back to the Personal Injury Guru Show. And today you heard from Connie Jo Russo, and she gave you a lot of good, valuable information on basically alternative ways of breaking up scar tissue, helping with the pain, things that are so critical to people when they're getting better. So again, I've tried it. It's worked for me. It's worked for a lot of people. It's something worth looking at. And especially if you're having chronic pain and you can't get rid of it, everyone's looking for some type of alternative medicine. Well, this should be one of them, because she does a great job. And with 20 years of experience, boy, it's hard to top 20 years of experience. You've also heard today about her movement towards helping children with cancer. I can't emphasize enough the importance of that, and obviously you know that. So if you can make a donation, don't be afraid to make that donation to her, because it's going towards a great cause. Also, she's got a golf tournament coming up. There's a lot of golfers out there, guys. Your money could be, well spent here playing golf and, of course, helping children. So look into it if you can, if you're golfers. Either way, I'm happy that she came on board today. We learned a lot of information that was very positive. So if you like it, don't be afraid to, push the button, ring the bell, give me a like. Also, you want to make sure that you give me comments if you have any that you need. I'll be happy to respond back to you at any time. You can follow me and, of course, subscribe to me. Very important. If you're on YouTube watching this, that's great. But if you just want to listen to it, you can go onto a platform such as Google, Apple, Spotify, and you can listen to it there. This is David Papa, and of course, it is the Personal Injury Guru Show. You can reach me at 727-500 LAWS Laws, in my email dpapa@papainjurylawyer.com, and just Google Papa Injury Law and you'll find me. Thank you very much, folks, and we'll see you back on the Personal Injury Guru Show.